Thanks for tuning in here. And we have Dr. Julia here with us. And today we're talking about the topic of breast health. And I was wondering if, Dr. Julia, you could go ahead and just give us a few of your key points that you discuss with women when you're talking about breast health with them. Thank you.
Hi, thanks, Dr. Julie. Well, in my practice, I tend to, I treat a lot of women and we all have boobs, right? And so sometimes I also have a lot of breast cancer in my family. And so the topic of breast health can be very emotionally charged, both for the patient and myself, but then also sitting through and kind of listening to, we all want to take care of our breasts. No one wants to have challenges. At the same time, it's kind of it's a topic that it's like, they're fine. Okay, it's cancer. Like, we don't have a lot of in the continuum. It's like, we don't know how to take care of our breasts until all of a sudden we're being given this huge diagnosis that is a lot of fear, And so women will say, well, how do I not go there? Like my mom, my sister, my auntie, I want to break that pattern. I don't want to watch that happen to me. How do I go there? And I often think about, breasts are a beautiful organ. They're not just blobs of fat. They are a collection of lymphatic tissue, but lymphatic tissue is unique. Lymphatic tissue, it needs movement, but also just from the breasts are a very specialized gland for nurturing. It's how the next generation receives food. So while they're being used for nurturing, a very specialized function in a short amount of time, that is actually healthy for the breast. However, the other piece of the rest of the years that the breasts are just connected to the woman, they're not totally separate. I actually see lymphatic and gut health playing into the lymphatic in the breast quite a bit. And when we have issues regarding, chronic digestive health and problems there, when actually the diet and the whole inflammation levels to the body gets tuned down, then all of a sudden the breasts start to feel healthier. The breast can show different mineral deficiencies, specifically iodine. And when women are struggling with thyroid, but they also have, fibrocystic breasts and their breasts feel lumpy and they're sore on a monthly basis, that speaks to me that maybe there's a nutrient that's missing, or there's an overload and toxicity in the system, and the body is putting the excess toxins into the fat stores. Because if those modern toxins were in our bloodstream, they could kill us. And a lot of our modern toxins are actually fat-based. They're not water-based. If they were water-based, your kidneys could excrete them quickly. But because they're fat-based, it is up to your liver to excrete them. But if your liver is not up for that job in that moment that you're exposed to this toxin, then the other choice that the body has is to put it in in storage. And fat storage in the body, the breast is one compartment for fat storage in the body. And so when we're exposed to higher level of modern toxins and we don't have the nutrients to help cleanse them out of our body, often they can get stored in the breast. And then when they're stored in the breast, sometimes when the breasts are uncomfortable, when the breasts are showing some sort of imbalance, disease, complaint, you're going, what's going on? Like, is it inflammation? But is there an issue where the whole body just really needs a good detox? The other thing that comes up for me for breast health is because it is the gland for nurturing, I often see where women, and maybe it's just my experience, but women who have their own self-care out of balance, like everyone else is more important than themselves. It's like their breasts are screaming because they're nurturing in their life, in their daily basis. Their plates are full and everyone else comes first and they're always last. That, I believe, is an environment that's setting you up for not optimal health. And so I'll often even if it's just a cue reminder, when someone asks about breast health, I can't help but say, Well, are you taking care of yourself just as well as you're taking care of everyone else? What if you were someone in your family, but not necessarily you? Would you approve of what you're eating? Would you approve how much you're sleeping? Would you approve of blah, 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 whatever we're talking about? But often women will give better standards for their loved ones than they will from themselves. And so I know that's not necessarily directly to breast health, but I use it as a cue in my mind because the breasts are a gland for nurturing. I'll often go, well, are you nurturing yourself? And, you know, I have 4 daughters, and so they're under 10, but they're starting to talk about boobies. And so I'll go, yeah, aren't boobies cool? And we need to take care of them. How do you take care of your boobies? I'm like, you take care of yourself. That's how you take care of your boobies. So I feel like that's the big piece. Hot pink is not going to cure our breasts, but we can take care of our breasts ourselves by knowing how to take care of our whole body as a whole. So I just encourage people to honor themselves and to take care of themselves, and to honor that their bodies are amazing. And often our bodies will give us signs that there's something out of balance, and the breast just as easy. It'll show. And the cool thing is, I have seen breasts absolutely repair themselves within a matter of months to year and a half. Like these, you know, risk factor breasts with all the signs that you don't necessarily want completely turn around. So the breasts are not just inanimate objects that just sit there as blobs of fat. Like they are actively living organs, and they can absolutely make a turnaround. So if you're concerned about your breasts, we don't have to go all the way into fear mode and apathy. We can absolutely do something, because to, you know, recap back to the eliminating the toxins that could be stored in the fat tissue and nourishing your body so your body has the ability to optimize your different biologic processes that are happening inside, can absolutely turn your breast health around. And it's really inspiring when that happens. And now I've seen it happen enough that I no longer see it as a coincidence or oh, that was weird. No, it's like now it's my normal that I expect. If you take charge of your health, you will see things turn around, and it's really beautiful. Thank you. Yeah, breast health, they're important. Save the boobies.